And really, what's important, I think, in rural medicine are a number of things. We have very important touch points. So we understand the importance of growing primary care in the community because that is really, besides the emergency department, having a family doctor is really important to the family and gets them into healthcare services. And so that's obviously very important. And we put a lot of effort into that. We also then have the advantage of working in our community and taking care of people that we see in the grocery store, see at church, see out and about, at say sporting functions. Our kids go to school together. There's just a number of ways that we touch our community in a very personal way. And so I believe that it is very personal for the employees that work here. Obviously, being in a town of around 9,000, right? We have been a very stable healthcare facility for a number of years. As a matter of fact, currently on our campus, and we started before we got to this location, but on our campus, the oldest part of our structure was built in the 40s. So we provide healthcare to the community and have continued to provide healthcare to the community for all those years. We like to say kindness is our thing. So if someone enters the building, we certainly want to greet them, help them get to be, familiar with where they need to be in the facility, and really it's the personal touch. It's really about caring for people the way you want your own family cared for, and we aren't so busy that we can't pay attention to the individuals that walk in our door. And it's highly important that we maintain really progressive healthcare services for a small rural community. Now, we're not doing open heart surgery, but we are taking care of them, let's say, in the emergency department with highly skilled board certified emergency room physicians, and we pride ourselves on the excellent care that we give to our community. To highlight the emergency department in your greatest hour of need, to have that available for stabilization and the connections that we make then to other facilities. I mean, we've got a helipad on top of the hospital so we can get you there. We've got, great ambulance services. So certainly stabilization, that the faster I would like to say that you get that stabilizing treatment, which is what we can provide at those critical moments, certainly does improve, your chances for, getting healthy again. So super important. Our community, for all the years that we've been at this location, we can look back in the archives and see that the message has been the same, and our board is very supportive. What's important for people to know is that rural independent hospitals are vital to all aspects of a small community. So, in other words, if you were recruiting, let's say, for the school system, or you're recruiting for perhaps industry, those families want to know that they have health care close to home. And so, what's really important is to support local, because we do know what we're good at, and we aren't going to overshoot and tell you we can do something that we are not able to do. But certainly that very basic care we are excellent at, and getting you the services that you need, making sure that your family's taken care of. Rural is important because otherwise, if you had to travel 30 miles for your health care, you probably wouldn't take care of yourself in the manner that you're able to because it's in your backyard. So we really need small. We don't need everything corporate. We need small. We are also always moving forward and trying to be progressive. So we currently have a couple of projects going on, and we are looking to the future to actually expand to the north. So what's important is that we stay relevant to our community, always upgrading services, upgrading our equipment so that they feel confident in what we do provide.